Hello and welcome to my presentation of CAM, Complementary Alternative Medicine. Today I'm going to be talking about acupuncture. My name is Kelsey Palestrant and this is from Damon College. Today I'm going to be talking about what complementary therapy is, a description of acupuncture. I'm going to be talking about the historical development of acupuncture, the indications for usage, as well as the contraindications, side effects, and adverse effects of acupuncture, the cultural considerations, some health teaching, and I'm going to be talking about a nursing research study in which CAM was used. Complementary alternative medicine has continued to grow over the years. CAM includes a broad and diverse set of healing therapies of different modalities, practices, and health systems. These modalities can be delivered by a trained practitioner or administered as self-care. What is acupuncture? Acupuncture is a technique of insertion and manipulation of fine needles into different areas of the body to achieve a therapeutic response. Acupuncture is now a widely used treatment in complementary alternative medicine in the United States. There are different theories to explain how acupuncture works. There are 4 here that I'm going to talk about. There is the gate control theory of pain. This describes that nerve fibers transmit a pain signal to the brain via the spinal cord. Input of other nerve fibers can inhibit the pain signal transmission. It is thought to stimulate inhibitory nerve fibers for a short period. This would then decrease the transmission of the pain signal to the brain. A patient who uses this theory would have a decreased amount of pain. Next, there is the endorphin model. In the 1970s, researchers isolated endogenous endorphins in the central nervous system. They then performed tests and studies that reported that inserting acupuncture needles into specific acupuncture points triggered the production of endorphins in the cerebrospinal fluid after the patients participated in the procedure. This provides an analgesic effect with acupuncture therapy, therefore decreased pain for the patient. Next is the neurotransmitter model. When research has been performed on animals, it has been discovered that acupuncture can modulate serotonin, norepinephrine, and neurons that transmit or secrete Y-aminobutyric acid. Through this neurotransmitter model, acupuncture can be a model used for patients with depression, anxiety, and addiction. This can happen because in depression, anxiety, and addiction, serotonin and norepinephrine are the things that are being manipulated. Other theories that describe acupuncture is research says that there are an increased electrical conductivity of tissues along acupuncture medians. The result is that manipulation of the acupuncture medians with needles may change the transmission of certain signals within the body. Treatment can affect respirations, heart rate, blood pressure, circulation, and immune function. The historical information about acupuncture is that acupuncture has been practiced in China for more than 4,000 years. It is an integral part of traditional Chinese medicine. It was first described in the writings of the Yellow Emperor's Classic of Internal Medicine in the time frame of 200 BC. Stones were sculpted into crude needles to be used as medical needles as early as 5,000 years ago. Other materials like bamboo, fish bones, bronze, gold, and silver have been refined into acupuncture needles. Acupuncture is based off the fact that living beings have an inner energy known as qi. Qi is the inner energy in an individual that sustains them. Balanced qi is vital to optimal health. Illness and disease are caused by the imbalance or interruption in the flow of qi. I'll talk about this more as we go on throughout the PowerPoint. Acupuncture was developed for prevention of illness back in the day for the Chinese. Now it is also used in managing disease of symptoms. It does this by balancing the flow of the energy qi. When did acupuncture come to the U.S.? Acupuncture became known in the United States in 1971 when the New York Times reporter James Reston wrote about his experience with this CAM procedure of acupuncture. It gained public and professional attention in 1971, like I said, and James Reston shared this experience with acupuncture after an emergency appendectomy in China. He experienced an increased amount of pain and bloating postoperatively. To provide relief, the Chinese physicians offered acupuncture as a therapeutic regimen. Reston was impressed by the effectiveness of this ancient procedure. He said his symptoms improved and there was no recurrence afterward. Through this publication of the New York Times, he exposed countless Americans to the complementary therapy of acupuncture for the first time. Why might someone use acupuncture, you might ask? So the indications for usage are the Chinese use acupuncture as a preventative measure. In the U.S., most patients use acupuncture as an adjuvant therapy for managing acute and chronic pain. The conditions can range from neurologic, musculoskeletal, and gastrointestinal symptoms. Neurologic, so I have a list here of all the ways that it could be used, and we're going to start with neurologic. So neurologic can treat migraines or tension headaches. Musculoskeletal can treat osteoarthritis, fibromyalgia, back and neck pain. Gastrointestinal could help nausea and vomiting, constipation, postoperative ileus, and irritable bowel syndrome. For gynecologic and reproductive uses, it could be used for hot flashes, infertility, and premenstrual syndrome. In the use of psychiatric or mood disorders, it could help stress, anxiety, and depression, like we mentioned that neurotransmitter model. For addiction, it could help nicotine dependence and alcohol dependence. For endocrine disorders of obesity, it could treat. Less common that acupuncture can help is ear, nose, and throat, which could be allergic rhinitis or sinusitis. Respiratory of asthma and COPD, cardiovascular, hypertension and angina, and sleep could help insomnia and enuresis or bedwetting. So many uses for acupuncture. Is acupuncture safe? So non-physician licensed acupuncturists provide the acupuncture treatments. There is a certain way you have to get certified by the state that you live in. The National Certification Commission for Acupuncture and Oriental Medicine developed a rigorous certification criteria and examination requirements for licensed acupuncturists. The needles that are used in the therapy are thin and flexible. They are made from solid surgical stainless steel. Acupuncture needles are different from hypodermic needles. Hypodermic needles are the needles that you get injections with. They have a hole in the center of them. This is not what acupuncture needles are. Acupuncture needles are finely tapered, which allows them to go into the skin very smoothly. Some needles, depending on the size, are thinner than a strand of human hair. Developed parts of the world, like the U.S., uses a single-use disposable needle, which are packaged by the manufacturer in sterile conditions. So some contraindications why acupuncture would be not allowed. The research stated that patients with bleeding disorders, or if they're pregnant, just to be cautious, because with bleeding disorders, it is necessary to inform the therapist of this before participating in the treatment. And for pregnancy, there's debates because there are certain acupuncture points that are contraindicated because they may initiate uterine contractions in premature labor. So if you have those things, I would just tell your acupuncturist. The side effects of acupuncture might include slight bruising, bleeding, or soreness at the acupuncture site because of the needle penetration into the skin. Some adverse reactions or events, organ puncture, infections, and bleeding complications can occur, but with universal precautions, there has not been a significant complication rate. Cultural considerations. In the use of Chinese medicine, acupuncture is a vital participant. Traditional Chinese medicine, known as TCM, is based on the concept of qi, like I spoke of earlier. Qi, or vital energy, which is believed to flow throughout the entire body. Qi is believed to regulate a person's spiritual, emotional, mental, and physical balance, and is influenced by the opposing forces of yin, negative energy, and yang, positive energy. Disease is said to result from disturbance in the qi. The yin, and the yang is imbalanced. Among what TCM traditional Chinese medicine is made of. There is herbal and nutritional therapy, restorative physical exercises, meditation, acupuncture, and remedial massage. Acupuncture derives from this traditional Chinese medicine, therefore they use it. It is different for everyone. Acupuncture is individually tailored to each patient and the patient's medical condition. Everyone can respond differently to this treatment, and some may need more or less treatments than others. On the average, most conditions can be treated with 6 to 12 sessions of acupuncture. The patient may need to return periodically for maintenance treatments to receive the long-term benefits from acupuncture. So some health teaching that I might want to include for a patient who is going to be involved in acupuncture is it is important to let the acupuncturist know if you are pregnant or having a bleeding disorder. Know that CAM therapies are different for everyone and that one person may have a different result than the other. That's very, very important for any CAM therapy. Next is check to make sure the acupuncturist has a license in the state in which you are receiving the treatment. Ask if the acupuncturist is using disposable needles. It's important for you to know that. If the acupuncturist is not using disposable needles, make sure they went through the proper sterilization procedure. If not covered by insurance, ask how much the therapy will cost out of pocket before the treatment. So a nursing research study that uses this therapy, this CAM therapy, is a study that took place at the Breast Ambulatory Unit of Department of Gynecology from the Federal University of Sao Paulo. The participants had chosen to receive surgery for the cancer. Surgery leads to longer survival, although patients develop a chronic condition of pain in the region of the scapular girdle and upper limb, including the thoracic and cervical spine. So in this study, the participants received kinesiotherapy, so the therapy of movement, with acupuncture for 30 minutes. The patients were assessed at baseline, after 5 weeks, and then at the end of the 10th week. The parameters that were observed were as follows. So the clinical and socio-demographic profile, shoulder range of motion and arm circumference, pain was assessed, upper limb function, and depression. The results stated that in the acupuncture and kinesiotherapy group, range of motion showed improvement in all the evaluated movements. The two groups had statistically significant improvement of pain. That is the key to take away from this. Therefore, the study presents extremely positive results in relation to exercise and acupuncture in the rehab of patients treated for breast cancer. So that was just a summary of what the research stated about acupuncture in the treatment of cancer patients with pain. This slide says, the research study tests the effectiveness of the acupuncture in rehab of physical and functional disorders. It was used to decrease pain caused from surgery. So that is basically what that research study did, and it did a great job to show what acupuncture can do. In conclusion, acupuncture derived from the Chinese culture over 4,000 years ago, like we talked about. Today it is used as an add-on therapy, mostly for people with problems in the neurologic, musculoskeletal, and gastrointestinal systems, mostly pain. It is safe if practiced correctly. It is used in many research studies for patients with many diseases and disorders, and many benefit from acupuncture physically and emotionally. There's my references, and I hope you enjoyed this presentation. Thank you for watching.